Excellent. Okay. And Julie, are we also going to have the registration chat?
I will pull that up and add that to the chat, Jean.
Fantastic. Thank you. So we ask everyone to sign in and let us know where you're from, because we want to be able to show the value of what we're doing, and we want to keep track of you. That's just all, it's all about that. And I'm in the process of trying to sign into my Google Docs so I can find out what I'm supposed to be saying today. So we're ready to go. I'm Jean Selzer. I'm with the career office at the University of Wisconsin-Milwaukee. And I would like to thank you all for joining us today. And I would also like to thank Julie Pickering, who is at the career office for the College of Engineering at UW-Milwaukee, for being my tech support. And Katie Farrago, am I pronouncing that right, Katie? I never did ask you that. Excellent, thanks. She will be talking with us about Advocate Aurora, all the opportunities that are available, and some of the great benefits of working at an Aurora facility, by the way, which are all over the state. So for those of you who are at a different area, don't worry about it, because there's going to be an Aurora somewhere near you. So just a real quick reminder that all of the career treks are recorded and they are on the website. And we have, what are the 2 poll questions we have today, Julie?
Today, the poll questions that we have, and I'm launching it right now, is to find out where the participants are attending school and what year they are.
So we would ask you to quickly let us know where you're coming from. And the registration link will be posted in the chat on more than one occasion. So if someone comes in a little bit later, obviously that will allow for them to see that we need to have that registration taken care of. Thank you for all who are doing the poll right now. Oh, we have 100% answered. Let's see where we're at.
Yes, we do.
Woohoo, and are we sharing? Many from Eau Claire and River Falls. I'm not sure why Eau Claire and River Falls are combined. And a lot of freshmen and sophomores. That's great, because this is a perfect opportunity for you to learn about the benefits. And by the way, in particular, we learned from Katie that Aurora has a fantastic tuition reimbursement program for those who are working full time. So, hey, how cool is that? All right, should we move on? All right, I'm going to go with yes. Oh, one final reminder is that next week's trek is Jockey International, hosted by Parkside. All right, let's move on forward. And here we are. We have Aurora, Advocate Aurora Healthcare. Sorry, Katie, I'm so used to calling it Aurora. I keep forgetting to add the Advocate.
That's okay. And I do the opposite. I always say Advocate.
Katie's from Illinois, the Illinois area. So Katie Farrago is a talent sourcing specialist, specifically working for nursing. So Aurora does a lot of their stuff separated out into the different areas. However, what she's going to be talking about today is across the board for all the opportunities with Aurora. So I am going to let Katie take it from here and take it away.
All right. Well, thank you for having me today. Yes, my name is Katie Farrago. I am a senior sourcing specialist with Advocate Aurora. I started my journey actually in nursing school. I worked at one of our locations in Illinois at Christ Medical Center. I then went and got my master's and did my work in healthcare management and organizational development, and moved into the HR role when I came back to the organization. So I did start in talent acquisition, and when I got hired back, I used to recruit completely for Sherman, which is in Elgin on the Illinois side, did all positions across the board for that specific site. Then we went to a new structure, and now I do specialize in nursing. So we do have a wide variety of positions. Whenever anyone hears healthcare, they always just think nurses or doctors, but there is positions across the board. So today we're going to talk about some of those positions, the benefits of working at Advocate Aurora, and what we're looking for in employees, and hopefully it gives you some insight on what we look for. So we have a quick video here to give you a little bit of information about Advocate Aurora. So you guys don't have to hear me talk the whole time. So go ahead and play the video.
La, la, la. Have to share the other screen.
To understand where we're going, we need to look at where we've been, how our organization has grown and emerged as a leader. It should come as no surprise that our view of the future is as daring as it is visionary. To reimagine what's to come, we're embracing new possibilities where technology and imagination collide. Together, we'll build on our vast platform of services to help people find their healthy place. The future is about getting well, staying well, and getting the most out of life. This approach to well care promises to radically transform how we think and work, while always putting people and their needs at the heart of everything we do. Where we're going is for the daring. It's for those who love helping others, who believe we can always do better and imagine more. Anything is possible when we apply ourselves, utilizing our imagination and our knowledge toward realizing our purpose of helping people live well. Together, we'll build a better model of health and find smarter ways to deliver wellness solutions. Going forward, we'll determine the course of our history, each of us vital to our story. As the authors of tomorrow, we'll write the next chapter for the future of health and wellness. We are Advocate Aurora Health.
So that's a great little video to kind of just touch base on Advocate Aurora as a whole. That actually is our CEO speaking in that video. When you work for the organization, you actually hear from him a lot. He is very involved, very hands-on. Even at the sites, he pops up for visits. Talked to him in the elevator many times. Great guy. But we are across the board Advocate Aurora Health. That is our main focus. And we merged with Aurora. Actually, we were just having our 4th anniversary of merging with Aurora. So Advocate was on the Illinois side, Aurora was on the Wisconsin side, and we merged 4 years ago to create one big health system. So next slide. There we go. So you can see Advocate by the numbers. We like to kind of always throw this slide in there. We have over 74,000 team members. We don't call them employees, we call them team members because everyone is on the team together. Over 10,000 volunteers, 8,300 physicians, 28 hospitals we're up to across the 2 states. So we are in Illinois and Wisconsin. We're spread out across both states. We have over 500 sites of care. Really lots of good info here for you. So you can go to the next slide. And we have another quick video in here, an introduction to the careers at Advocate.
There's something about you. Maybe it's how you always do more than you're asked, or how you always bring a smile to even the toughest situations. Other times, you lend a helping hand. You do the little things that make the biggest difference to the people we care for. You know that the things that really impact someone in need are the things that don't show up in job descriptions, but instead are remembered and cherished for the rest of someone's life. That's right, you did that. You, and you, and you too. Truth is, we couldn't do what we do without you. You are kind and hardworking. You always think about the team, and you never lose sight of why we're here. Caring for others is just who you are. And you make our team of healthcare professionals that much better. We have an amazing team here, and we're always looking to get better. That's why we're looking for you.
All right.
I'll be right with you.
No, no problem. I was like, I'm not sure the next slide is.
No. Are you still there?
Yep, we're all here.
Oh, PTL. Okay. All right. I lost you for a second.
I can talk about that video while she's trying to get the
Sure.
presentation back up. That video, they do a lot of marketing material and presentations like that, which is awesome. They are very, very big with Advocate Aurora on having a very diverse group and having everyone find a home that fits them, which I think is amazing and awesome and all in the same, because that's what our goal is. It's finding the right team member to fit with us and fit our vision. So some professional positions, this is kind of listed what's on the site, but it seems limited when you read this. I mean, I want people to know that they hire engineers, they hire lawyers, they hire finance, accountants. So we have across the board open positions in all different areas. So it does not necessarily have to be healthcare. I'm part of the team that works with our what considered business residents. And we've actually had a couple that I've worked with specifically from UW-Madison, specifically the MBA programs there. And they get hired into a residency year program, into the administrative roles. So there is across the board things. So don't feel that you're limited just because it's healthcare. So there are quite a bit of programs out there. So the next slide. So here's the fun stuff, benefits of working at Advocate Aurora. So we help people live well, which who doesn't want to do that, right? Especially what we've all gone through with COVID in the last couple of years. We have seen so many changes in healthcare, and it's been amazing to see what our team has done across the board. I've been fortunate enough to be part of the teams that's hired our vaccine clinics. So I was actually on a team of about 5 of us that did all the hiring for the Wrigley Field vaccine clinic. So that was really exciting to do that when we did that. And then we also staffed all the vaccine clinics around the states. That was kind of awesome to be part of that. Opportunities for growth and advancement. They have leadership training programs. They really work with you if you want to grow in your field and move up with your career track. They really have people that work with you, get you through the process to get you where you want to be. Training programs are offered. We do have CNA programs, phlebotomy, histology, medical assistant training. Our workforce development team works closely with a lot of programs and getting people through these programs, getting funding, and helping them find job placements after. Tuition reimbursement is always a huge one. So there is $5,000 annually for full-time employees. Part-time employees are eligible too. The number just goes down. We actually have a sheet on that that we hand out so everybody can look. Education assistance starts from day one, but it has to be for anything moving forward. They don't do from previous education, it's moving forward through tuition reimbursement. Currently, they just started a program where they are paying back student loans for registered nurses. Right now, it's only for registered nurses. Trust me, I wish it was for everybody. And I think they're pushing for that, but they just started this actually within the last couple of weeks. So that's a huge thing we started doing. And we also have school partnerships with specific programs. So if that's something you're looking for in the future, let's say you're an RN and you want to do an NP program, we do have special partnerships at very deep discounted rates. So that doesn't count as your tuition reimbursement. You get those discounts for being an Advocate Aurora employee. Healthcare coverage, dental coverage, vision, all the across the board, they have some great things there. We even have adoption assistance, which I think is just amazing. Paid time off, I think, is very important for anybody for their well-being. I have never complained about my paid time off. And you can use it for anything. That's your sick days, your mental health days, whatever you need it for. That is your time, and you start accruing from day one. We do have the discounts through benefit hubs. There's travel discounts, car rental, homeowners insurance, discounts across the board. So that's kind of a cool perk. And most importantly, a culture where we value our employees' ideas and feedback. I would say that is huge. You don't realize it until you actually get into your field and start working how important that is to you, because you want to make sure, and especially in an organization this size, that your voice is being heard. And I think they really do a good job of that. So next slide. Diversity is a huge thing in society today in general. With the TA talent acquisition team, which is our team, We work constantly in all areas of diversity. And with us specifically, we do monthly DEI sessions with organizations to always be up on things, to change. Sorry that my computer's going off. To keep up with things, what's changing, to make sure everybody is comfortable with everything. The returning citizens program, that's something that they're really focusing on now. That's citizens that are returning from incarceration. They're working with that, getting them back in the community and jobs and supporting them. We have a strong program with past military. So that's a really big thing that they push. So next one. The hiring process, this is always fun. Everybody always asks this. So the hiring process, you would go on the Advocate Aurora website. We just got a new work program last week. So that's been a lot of fun in the last week. You would create a profile and submit an online application. Make sure your resume is updated. The next step would be you would get a phone interview with recruitment. Basic interview with that, kind of your behavior-based questions. They want to know why you're applying, what you're really looking for. Is this a job for you? Make sure you're a good fit with the organization, the mission, values, things as a whole. They'll kind of go through your resume with you, ask you from your experience, or even if you're a new grad, kind of what got you to this point. The next step currently, because of COVID, is a virtual interview with the hiring leader. Now, I will say this is changing. In fact, I'm doing my first in-person event in 2 years next Wednesday at one of our hospitals in Illinois, which we're very excited because it's going to be in person. But right now, besides something like that, an event, everything is held virtually. So the recruiter would then set you up virtually through Teams for a video interview with the hiring leader. Sometimes the hiring leader is by themselves, and sometimes you have part of the peer team with their assistant with them as well. And then from there, if they're going to make you an offer, you will begin the pre-employment process and on your way to becoming a full-time member. So that is the process. Next one. And I would say I should go back on that. I'm sorry. I would say it's hard to answer how long that process is. Everyone always has that, magical, they want that magical answer to that question. How long is it going to take? And it's different with every single site, every single position. In a perfect world, I would love to say that if you applied, you would be answered probably within 3 to 5 days, a response, and get an interview within a week, and then get a response. We like to get back within 2 to 3 days. But like I said, that'd be a perfect world. There's not, things always sway a little off track. So what do we look for in employees? Compassionate and patient focused in our medical areas, definitely. Excellent oral and written communication. We definitely want team players. That's huge because let's face it, sometimes you spend more time with your coworkers than you do with your family. So we want people that really mesh well together, and that's a big part. Flexibility and scheduling, especially we've seen this in the last couple of years with COVID. I mean, being flexible with your schedule is huge. There are times that people think, oh, you work 8 to 5, it's, but there's times that I've been on my computer at 9, 10 o'clock at night because we have people that work night shift and I have to deal with them too. And that's totally fine with me. Excellent customer service skills, strong organizational and prioritization skills, and values, differences, and diversity. So those are the basics that I would say that we initially look for in employees. That's kind of big. And it's very hard, especially when you're doing virtual interviews. You really have to kind of get to try to know somebody through a computer screen, which can be challenging. So next one. So resume tips. This is always my favorite. I do probably 75% of the time on my job is coaching and resume writing with candidates, with new grads. So these are just some basic, but I would say the spelling and grammar check is probably the biggest thing that we really encourage people to look. Nothing's worse than when you're applying for a position and you have misspelled words on your resume. I always tell people, have people proofread it. It doesn't matter if they're in HR or not, have everybody proofread it. Use everybody you can to do that because they're going to all give you a little bit of different pieces of advice. I don't want to say there's a right or wrong to resumes exactly, because we all kind of look for different things and it kind of really is based on the position you're applying for. So these are some of the basic things that you definitely want to make sure you have on there and are spelled and listed correctly. So that's kind of like the foundation of your resume that you should have on there. As a new grad, you definitely don't want a 3-page resume. Or if you do, there's going to be some good reasons why. If you did your doctorate, or, you know, you had presentations you did, or, you know, something, or published, you know, that's a different situation. But a basic resume, you're going to want to keep it on one page, because people have to realize that we look through so many resumes through the day that it's very quick. We kind of know exactly what we're looking for. We, you know, skim over it, kind of look through, dig deeper then into it as we're going through it with you. So next, virtual interview tips. Just like any interview, just because it's virtual doesn't mean anything really changes. So be on time, be early. That is one of the biggest things. You never want to show up late. And if you're having trouble with technology, which happens, send an email or pick up the phone. Say, hey, I'm really trying to do this. I just got logged off. I'm trying to log on again. Let them know that you're there and you're engaging with them. Dress appropriately from the waist up, because we've all seen those commercials where the guy's in his, I think it's a coffee commercial, where he's like in his boxers or something and on a work call. You don't want to be that person. Make sure you're in an area that is quiet without distractions. No lie, I've had people that are in their phone driving down the highway trying to do an interview. Doesn't work very well. So make sure you prepare and give yourself enough time, enough space, and everything where everybody in your house is kind of quiet. We know that things are going to happen. Your dog might bark or somebody comes in, but try to do your best at that to prepare for it. Make sure you're close enough to your Wi-Fi. Like I said, we know technology, things happen, but just have that backup with a phone number or something. Making eye contact. I have managers that won't even turn on their camera because they want to see how you react and how you're engaging to the questions. So that is something, you know, to think of. And be prepared to give examples of past experiences, because, you know, especially if you're a new grad, you haven't had experiences specifically in this field. You can go back on your previous experiences that aren't from that field, because they all kind of relate together. They want to get to know the type of person you are and see your body language. They want people that are talking. They don't want to have to pull answers out from you. And I always tell people, find a way to make yourself comfortable. I don't care if it's when the person comes on, say, hey, how's your day going? That's easy to get out, breaks the ice, get some talking, get you a little bit more comfortable and in the zone to be ready for it. So next one. So that is the presentation we have. I know we kind of went quick, but I am here to answer any questions, help you guys in any way. If you can think of anything, and if I don't have the answer, I always give you guys my email. You can email me on the side. If you don't want to put it in the chat, you know, anytime if you want me to look at your resume, you have something, an internship you want me to look into, like I said, I'm here to help you guys in any way that I can.
So who has some questions for Katie?
Hi, can you guys hear me?
Yes.
Oh, perfect. So I know you said that all the job opportunities weren't healthcare based. Can you tell me about like some maybe marketing opportunities or like communication based opportunities?
Oh yes, we have those. I don't know the exact specific ones that are open, but I was just actually, before we came on, I was telling Jean that we have multiple marketing teams. So we actually have a marketing team just for TA. We have a marketing team over the whole organization. We have people that focus on our ads, our videos. We have people that focus just on social media. So there is a wide variety, and there is Illinois teams and Wisconsin. So if that's something you're interested in, you can definitely email me on the side and I will get you to the right person that you know, can give you more detailed information specifically on it.
Okay, thank you.
Yeah.
And I don't know if you can see the chat, Katie.
Yep.
Malik has a question.
Yep. So social worker positions, are majority of those are going to be inpatient hospital based. So that, you know, so that specifically would be, you go on a career site, you can narrow it down to social work, and then it would list all the different sites that we have open for that. But they are hired specific to sites. So you are at one location with that. I don't know off the top of my head of any that are open, just because that's not my specialty area. But again, if you see something, if you do look online too, and you see something and you want information about it, I have no problem if you email me. You can put down the position number. That is very helpful. And I can definitely get you connected with the person that's recruiting for that.
And I think for those, you know, if you're looking at the website, look under behavioral health on the career areas, look under behavioral health, I forgot, what else did I see?
Yeah.
Oh, the hospice area probably uses social work people and that
Yeah.
kind of thing.
Yeah, and those, a lot of, you're gonna see that it's gonna, sometimes it's scary to people when they look and they see, like, for example, in Wisconsin, we have a hospital that is just specifically behavioral health. So they see so many positions at that one hospital, and people don't realize that that's all that they hire at that hospital. So some of our hospitals have much larger behavioral health units, or they have a hospice wing where others don't. So I think also, on that situation, do some research when you see those positions, so you know what area it is, and it's not just like one floor. It might be a whole section, or a whole separate wing, or just so you know the size of it, what you're getting into in a sense.
So Katie, tell me a little bit. So Advocate Aurora is huge. We know that, right?
Mhm.
Tell me what it's like for a person who's working in an individual area. Does it still feel like it's really huge? Like you're not even really connected to anybody? How does it work? What's it like?
Well, and that's an interesting question. I left the organization and came back because I missed it so much, because honestly, it is a great organization to work for. I think you kind of get a mixture of both. So if you're site-based, you do kind of have your family at that site. So my sister and my niece are both nurses at one of our hospitals. And, they are very close to, they have a lot of stuff that goes on at that one individual site. But then they also have a lot that goes on throughout the organization, that they keep you in touch with everything. So if something happens at one of the other sites, you definitely know about it. They have a lot of communication that goes on about it. So I think you kind of get the best of both worlds. It's kind of how involved you want to be in the organization as a whole, but you do have that smaller feel with the site based. For TA, we've been remote even before COVID. So that's really taken a lot of that away. So we had to get really creative to keep our team together. So we do a lot of social meetings, like social events, I'd say. We try to do meetings in person. We just held a yoga night for nurses, so we could all get together in person. So I think they really do a good job of trying to keep, everybody engaged together.
That's cool.
Yeah.
Any other questions? It's a quiet group today.
We did so good, they don't have any. No.
Yeah, there you go. You did such a good job. You can unmute yourself. Feel free. Okay. All right, folks. Last chance. Last chance. Okay. All right then. So thank you so much, Katie.
Thank you.
I appreciate your taking this on and sharing with us all that you know about working for Advocate Aurora. And I would love to see, so thank you also for providing your email address. That's pretty cool. Right, folks? So we'll send Katie's email address out for folks if they have any
definitely
special
I'm
questions.
here to help. Like, I am not one of those people. I'm not going to get mad at you guys, even if it's not my department. I think it's really important. We've all kind of been in that situation, and you just need somebody to kind of guide you in the right direction sometimes. So
right.
Yeah. And if you're not comfortable talking about it now, like I said, email me. I'm here anytime to help out. But thank you very much for having me.
Thank you so much. And everyone, thanks for joining us today. And please know, we may need you to click back on that link to do the registration. So we're all set to go. And have a great day. Remember, Jockey is next week.
All right. Thank you.
Thank you so much, Katie.
Take care.